Moving on to our next topic of discussion, which is the retropharyngeal abscess. As you know that there is a retropharyngeal space behind the pharynx, and abscess in that particular area is known as the retropharyngeal abscess, right? Retropharyngeal space is divided, we would say, by a fibrous raphe into two lateral compartments, right? And prevertebral space is something that you should be knowing, that retropharyngeal space is extending from the base of the skull to the bifurcation of the trachea, but the prevertebral space is extending from the base of the skull till the cox. It is having greater extent as compared to that of the retropharyngeal space. Now here, clinically on examination, one thing you should be seeing, if there is a midline bulge, right, on investigations, if there is a midline bulge, it means that there is prevertebral infection, and if it is a unilateral bulge, it means that there is a retropharyngeal infection. So these are the investigation points that you should be focusing on. So acute or chronic, these are the two types. Chronic is also known as the prevertebral abscess, and acute retropharyngeal abscess is now our topic of discussion. It is seen in children below 3 years, right? So if something is swelling from the posterior aspect, so what will be the sign and symptoms? Dysphagia and stridor, torticollis, bulge in the posterior pharyngeal wall, right? Usually seen on one side because this is retropharyngeal space. The investigations that we do are the radiograph and the CT scan, and the treatment is incision and drainage of abscess, antibiotics, and tracheostomy if the airway is obstructed a lot, right? Now moving on to chronic retropharyngeal abscess, it is also known as prevertebral abscess, which means that there will be midline bulging, right? And this is an important MCQ point, that this is tubercular in nature. It occurs after or during the tuberculous infection, right? Caries of cervical spine also occur, right? So in this particular disease, the symptoms are very unique, right? If in the scenario there is caries of cervical spine and tuberculous infection, then our diagnosis should be going towards prevertebral abscess or the chronic retropharyngeal abscess, and the person will be presenting with discomfort in the throat, tuberculous lymph nodes, caries of cervical spine. X-ray is the diagnostic investigation, right? Treatment is incision and drainage of abscess, as well as you have to give anti-tubercular therapy, and orthopedic spine surgeon should be the part of the treatment team, because the caries of cervical spine, this is not just only the work of ENT specialist. An orthopedic spine surgeon should also be involved in this particular treatment. So this is it.